Okay, so now we're going to talk about surgical asepsis. This is sterile technique, and the goal of surgical asepsis is to eliminate all microorganisms from an object or area. So as a nurse, you will need to be able to maintain a sterile field. In LPN school, you learned this. In emergency medicine, this is usually a lower priority because we're concerned about keeping people alive. So this is going to be a refresher if you have not been doing a lot of sterile procedures. This is kind of muscle memory, hard to hold on to if you're not doing it frequently. And if you've never done a lot of sterile procedures, this is something you'll need to work on. These are the guidelines that we use, and we're going to practice donning sterile gloves, and we're going to practice doing sterile procedures in lab. So whenever you are opening something that's sterile, you need to know what is supposed to remain sterile and what you can touch. So your gloves, for example, are going to be packaged in a way you can remove that sterile package, and what you're touching, the outside, is not going to remain sterile. Okay, when you unfold that glove package, you should not touch anything on the sterile side of that paper or any part of the glove except the cuff that you're using to pick it up. Okay, so you need to be able to open things without touching the sterile surface. If you have a sterile field, which would have to be covered with a sterile drape, and you need to add things to that sterile field, you need to be able to do that without touching either the item that's going to remain sterile or the field. So that there's some techniques involved there. You can touch a sterile item with sterile gloves. You can touch non-sterile items with your hand or a clean glove. You can't mix those up. You need to avoid coughing, sneezing, or talking over a sterile field. You want to ask the client to avoid movement, touching the field, or touching items on it. The only things that can be put on a sterile field are sterile items. If you add something to a sterile field that is not sterile, now the entire field is considered contaminated. There is a 1-inch border at the outer inch of a sterile field is considered non-sterile because it's kind of no man's land. We don't want to put not sterile things on it because then we have to move our border in 1 inch, but we cannot put our sterile things on it either. When you're unfolding a sterile package or a sterile drape, the first fold should be away from you so that when you have everything uncovered, you're unfolding toward you rather than reaching over your sterile field. You don't want to reach over a sterile field. Anything above your shoulders and below your waist is considered contaminated. So if I put on sterile gloves, I need to keep them between shoulders and waist and in front of me. If I put on a sterile gown, I'm still only considered sterile from shoulder to waist. So if I put my hands up here, not considered sterile. You will see people hold their hands in front of them so they're not touching. You can still see it's sterile. But if you put your hands below your waist, it's not considered sterile. If I put my hand behind me, it's not considered sterile. If it's not in the line of sight, it's considered contaminated. You want to drop items onto a sterile field from around 6 inches because you want to make sure you're high enough that you're not touching, but close enough to that field that it's not hopefully going to bounce off. If you're pouring a sterile solution, you need to pour that into a sterile container without touching because the outside of your original container is going to be not sterile. If you open a sterile solution for the first time, you can pour it into a sterile container. Sterile solutions can actually be reused for up to 24 hours as long as the solution, the rim, and the cap, the inside of the cap, are not contaminated. So if I take that cap off, this is my sterile saline. If I take that cap off, I hold it in my hand to avoid contamination. I pour, replace the cap. Now that's considered, still can be considered sterile for 24 hours. I need to date, time, and initial that container. The next time I go to use something from that container, I'm going to do the same thing. Hold this cap in my hand, and I'm going to pour just a little in the trash can over the lip of that container. Just kind of lip it and then pour into my sterile container and close. They're making more solutions in smaller containers now to avoid the need to reuse sterile solution. You also should hold any liquid that you're pouring. You should hold the label in the palm of your hand so that you're pouring away from the label, that's so that the label remains legible. Don't reach over a sterile field unless a sterile field specifically has a waterproof drape. If there's anything wet or it's contaminated. So if I unfold my glove package and I unfold it, I laid it down on the table and there's dampness on that bedside table, makes that paper wet, that's not sterile because bacteria can actually go through that. If sterile packages are torn, wet, or soiled, they need to be discarded, not used, and pay attention to expiration dates. Items that are sterilized in-house usually have some kind of a tag to indicate how long they're good. Okay, so next video is going to be about infection control.